Welcome back. According to a 2014 United States study, the average cost of developing and bringing a new drug to market was $2.6 billion US. That cost hasn't come down since. Drugs for rare diseases and conditions can be horrendously expensive for patients and may be unprofitable to develop. The Hong Kong government subsidises some 1,300 medicines listed on the Hospital Authority's drugs formulary. However, some Hong Kong patients with rare diseases require drugs that are not on the list.
我想請你哋大家一齊嚟睇下我個肚，唔明白我嘅人個個都可能以為我係一個有咗 BB 嘅媽媽，但唔該唔係啊，我唔係有咗 BB， 我係因為呢個病生晒太多腫瘤，生到而家個肚大到係咁樣。我而家先得個30幾歲，係咪就要俾呢個病去折磨我去死？我唔甘心啊！求下你哋幫下我哋啦。
Her wish did not come true. A week after, 36-year-old Ji Yinlan made her appeal to a LegCo panel, she died. The medicine that could have helped her costs $20,000 per month and is not subsidised by the government at any public hospital or clinic. Ji's death has sparked a public debate over whether more money should be allocated to patients with rare diseases. On May 9th, legislator Fernando Cheung hosted a meeting to give patients and concerned groups an opportunity to talk to representatives of the Hospital Authority and the Food and Health Bureau. Cheung says the authorities promised to follow up on funding for those suffering from rare diseases, but details won't be announced until later this year. Markerson has a genetic disease called spinal muscular atrophy, also known as SMA or Verdnig-Hoffmann disease. He's a type 1 patient suffering from the most severe and common form of SMA, in which a missing gene prevents essential protein production and causes fatal muscle weakness. 90% of those with the condition die before they're 2, often due to respiratory failure. Doctors spotted Marcus's SMA symptoms during his first 6 months. Since then, the physical challenges he has faced include trouble in breathing, swallowing and walking. According to the University of Hong Kong's Department of Pediatric and Adolescent Medicine, there are currently 90 SMA Type 1 patients in Hong Kong. Every night when Wenus and her husband Brian get home from work, they spend at least 4 hours alone with Marcus. They stretch his limbs while making sure he is well entertained. They fear the disease could worsen and take away their son's life at any moment.
佢而家其實已經有脊柱側彎㗎啦，咁其實而家20幾度啦，咁其實好多啲醫生嗰啲同我講，其實如果以佢呢隻病個 case 咧，其實會越嚟越嚴重嘅，咁可能到真係40-50度嘅時候咧，要做手術㗎啦。
What seemed to be good news came when Wenus and Brian learned that Spinraza, a new drug that addresses the underlying genetic cause of the disease, was approved by the US Food and Drug Administration last December. It's the only FDA-approved drug for this genetic disorder. However, Spinraza costs as much as $6 million for the first year of treatment and $3 million a year thereafter. The Department of Health and Hospital Authority still have to approve the drug before it can be introduced into the drug formulary for public hospitals and clinics. Wenus and Brian hope the government will approve and subsidise the drug as soon as possible.
啱啱佢確診嗰陣時咧，我都好記得，真係醫生同我講。冇藥醫嘅呢隻病而家，咁你好好愛護佢啦，帶佢翻屋企啦，即係講到好似食飯咁樣，咁我哋真係好努力維持佢嘅生命咯。咁好啦，到真係隻藥而家有啦，原來仲要我哋其實 keep 住睇到外國好多新聞，其實係真係好好嘅反應，即係 啲小朋友打咗係明明好似佢咁，你點知可以企到少少喎？你唔好話佢企到少少啊！如果佢坐到，佢條頸有力，佢已經好開心噶啦。
咁我哋都希望睇下香港政府可唔可以幫我哋，即係同藥廠嗰方面可以即係去議價一下，即係可以去到一個我哋負擔得到嘅水平。咁當然最理想啦。我哋都唔係話希望話完全政府幫晒我哋，但係如果你話係600萬一年，根本上我哋冇可能係支付得到咯。
The Hong Kong government doesn't have any official definition of rare disease or any specific policy to support these patients. As these diseases inevitably affect only a limited number of people, they pose special challenges due to insufficient knowledge or training in the medical sector and due to the high drug costs for treatment. In 2005, the Hospital Authority introduced the drugs formulary to ensure access to cost-effective drugs that are safe and effective for all patients. The formulary is divided into 4 categories: general drugs, special drugs, self-financed items with safety net, and self-financed items without safety net. Drugs not included in the formulary cannot be prescribed to patients by doctors in public hospitals or clinics. According to the Hong Kong Alliance for Rare Diseases, there are people suffering with over 30 types of rare diseases in the SAR, only 8 types of which can be treated with drugs on the formulary. On May 2nd, a Food and Health Bureau spokesperson said the government has given additional annual recurrent funding of $75 million to the Hospital Authority for drugs to treat rare diseases.
社會上呢部分人呢，係需要有一啲喺一般成本效益以外嘅一啲投放呢，佢哋先至可以維持生命同埋健康。咁所以政府係應該考慮呢啲例外嘅需要呢，係有一個特別嘅資源或者一種特別嘅政策去對應。咁呢個正我相信都係世界各國點解有罕病政策，就係咁樣。因為如果你擺喺一般嘅公共衛生入邊去處理呢，的確係即係冇辦法處理得到。
Legislator and doctor Pierre Chan believes the drug formulary is in some ways restricting medical choices for doctors and patients in need. But he says a more pressing problem is the excessive pricing of new and effective drugs, which barely no one can afford.
香港政府奉行呢個資本主義同埋商業嘅社會，成日我都話一啲嘅監管啊或者管制呢，都係對醫生同埋病人。其中一個咪就係藥物名冊。除咗我哋去逼政府去令到佢鬆啲手，放多啲資源錢落去，令到病人受惠之外，大家都要諗下開價嗰個藥物開到300萬、600萬嘅藥物，係咪俾佢繼續開？下次開落3000萬。
Dr. Raymond Liang is a member of the Hospital Authority and a specialist in haematology and haematological oncology. He's been working at the front line for over 30 years. Liang says the drug formulary is only useful when prioritising different types of drugs, given that there are finite resources. It does not address a fundamental problem in the pharmaceutical industry.
政府要同藥廠嗰方面去傾，係可唔可以用啲平啲嘅價錢去攞到呢啲藥嚟到俾一啲比較窮困嘅病人係負擔唔到呢啲藥嘅，或者係尤其呢啲藥好多係要長期食嘅話咧，會唔會有一個封頂嘅安排咧？譬如每年係真係嗰個藥費係有一個嘅上限啊，咁變咗可以能夠佢哋負擔得到咧？又或者係用政府直情立法嘅形式去監管呢啲藥價，係外國都有呢啲咁嘅經驗嘅，佢哋係有一個委員會去制定呢啲藥價，就唔係可以藥廠去自由定價嘅。
Last Friday, the Civic Party and the New People's Party both held anniversary dinners. Most government officials chose to attend the New People's Party party rather than the Civic Party's celebration. Incoming Chief Executive Carrie Lam, who hasn't shown up for the past 5 years, did, however, attend the Civic Party dinner and even stayed for some performances. We'll leave you with some images taken at these parties so you'll get some idea of what you didn't miss. But do make sure not to miss the Pulse next week. Goodbye.